Okay, we are going to work on this. We are starting at slide 113 for John's disease. What you need to know about John's disease, it is reportable. The etiology, what causes it, is the Mycobacterium paratuberculosis. Transmission of this in utero and transmammary. What does that mean? In utero means it happens to babies that are in the uterus, and transmammary means it will happen to babies that are nursing. So it can pass through the barrier in the teats and to the babies. Infected animals will transfer it to calves as well through fecal to oral. So let's say mom lays down in the stall or out in the field and she gets feces on her teats and the babies drink from it. They will get it, as well as eating grass, grazing on grass where there is feces that's infected. Animals 6 months and younger are the most susceptible to this. Adult animals typically don't get infected with it. They can be carriers, they can have it, but they won't contract it as adults typically. They will contract it as younger animals, but you won't know they have it till they're older, and we'll explain that here a little bit more in a couple slides. It causes severe granulomatosis reaction with thickening of the intestinal wall. That's granulomas are like healing type tissue, scar tissue, and then because of this, because they get like the scar tissue on the intestinal walls, they are unable to absorb protein. That's what protein malabsorption means. You can see there, infected walls. You see the cow there. This is what happens. It's a wasting disease. They get thinner. Symptoms, diarrhea. They'll eat normally, but they will have weight loss because they can't absorb protein. Because of this, they will also have decreased milk production. They will also develop something called bottle jaw. You can't really see it on that cow, but they will have like thickened walls of the bottle, or thickened neck of the bottle, of the jaw. Clinical signs usually don't show until the animal's older, like 2 or more years. That's what I was saying. You can have infected animals, but you won't know they're sick because they eat normally, they act normal otherwise, but they have diarrhea and they just lose weight as they get older because they're not absorbing protein, which is why, one, it's reportable, because it's one of those things, if we know that it's out there, we're going to have to detect, or we're going to have to notify somebody so that we can check the whole herd, make sure, because everybody's probably infected, because you have an infected cow that's just been pooping everywhere and animals out there grazing on that. Diagnosis, you can do a serological test, so you're going to send some serum in, they're going to test it. Fecal culture, you can find this when you take some of that diarrhea, you send her it, they culture, they find the bacteria. You can have false positives and false negatives if they're not shedding it. Clinical signs, just a history and lack of response to treatment. You have diarrhea, you're treating it for the diarrhea, you're giving antibiotics, it's not responding. Treatment, or to control it, it is a terminal disease. There is no treatment. This is important. That's probably a test question. It is terminal. They're going to die. There's no ifs, ands, or buts about it. There's no treatment. Repeated serological testing and fecal cultures. So if you have this animal that's not responding to treatment, it still has diarrhea, it keeps losing weight, and it's not responding, because we can have false negatives, you keep doing that serological testing until you can figure out what it is, especially if nothing else is coming up. You can call sick, you're going to call positive animals. Anybody that comes up positive, you report it and you euthanize them. Because you don't want to keep spreading. If you have a sick animal that's not responding to treatment but not coming up positive, you're still going to cull that animal, because just in case you're getting false negatives. And it's not fair to the animal if they're not responding to treatment. So it becomes the more humane thing to do at that time. Also, you will I mean, even if you don't know what it is, you have a sick animal that you keep sinking money into, and you're going to start losing money on the animal. So it just makes sense from a financial standpoint to call that animal, even if you don't know what it is. You can probably necropsy that at that point. Look at the intestines, see the look of the intestines, all that granulate material or intestines and tissue, and be like, oh, looks like we got John's disease. And you're going to isolate sick animals. You don't want them out there with everybody else spreading it around. There is voluntary testing and control programs in place. You want to have that going on just to make sure. Next disease is foot and mouth disease. This is a virus that affects cloven animals. Cloven animals means hoofed, two hoofs. Symptoms, you have oral and foot lesions, which is why we call it foot and mouth disease. Transmission is very highly contagious. You can transfer it either through direct contact or indirect contact. It is a foreign disease. It's not from around here typically, and you are going to quarantine those animals. And there you can see on the next slide, oral and we have oral lesions here, some lesions here on the cloven foot. Dermatophytosis, also known as ringworm. This is zoonotic. You can catch ringworm. Fun fact about ringworm, it seems to be one of those things that when it comes to people in vet techs, there are people that can, I swear, they hear the word ringworm and they break out in ringworm. They don't even have to look, they just have to hear the word ringworm and they break out in it. I'm being a little bit facetious here. You can't see my face, but I'm being a little bit sarcastic here. But there are people who catch it very, very, very easily. And then you have people like me. I've never had ringworm. I have cuddled cats that had ringworm on it. We didn't know it yet until we did some testing. Oh, that cat has ringworm. Like, oh, I've been cuddling that animal. When I worked at Northview, we had a cat that lived on our ICU for about 4 weeks. It was a little Persian kitty, very, very, very cute. Had terrible ringworm everywhere. And because I'm one of those people that don't catch ringworm, I was the ringworm. I'm always the isolation queen whenever we have a parvo dog or a ringworm animal or something contagious and infectious that needs to be isolated from everywhere else. Somehow I always end up being the isolation tech, and I'm always the person that goes in that room. It's usually a room that's off to the side of everything else. It has a double entrance. You have to gown up, glove up, put booties on, put a cap on to go in there so that you don't do fomite transmission, you don't get it all over you. There's usually a foot bath of bleach or rescue or something that you have to step in to make sure you don't have it on your shoes and track it all around the clinic. Particularly if you're doing something like lepto or parvo or something along those lines. But this kitty lived in our isolation for about 4 weeks, and I was isolation tech, and I would go in there and love on the kitty and never caught it. Same kind of goes for animals. You have animals that will catch it, and you have animals that won't. It is a fungus. It is not a bacterial, and it's not a worm. I know it's called ringworm, but it's not a worm. It is a fungus. The dermatophytes, or the names of the fungus that can cause it, are Microsporum, Epidermophyton, the Trichophyton verrucosum. The causes of this, overcrowding in wintertime will cause this. You got a lot of close animals. Overcrowding causes stress. We've talked a lot about how stress decreases the immune system. Immunocompromised animals. These are older animals. These are sick animals. Pregnant animals, or animals that have just gone through delivery, because that's very stressful and that takes a hit on their immune system. Exposure does not always mean infection. Like I said, some of us never catch it. Others of us catch it just by hearing the word. Cows are the same way. Again, it tends to be people who have a little bit weaker immune systems, or cows that have weaker immune systems, that will catch it. Symptoms, you'll have dry circular lesions. What does alopecia mean? Alopecia means hair loss, usually around the head and neck in cows. Treatment, this does tend to be self-limiting in cows. Self-limiting means it'll go away by itself. Sunlight, and typically cows get a lot of sunlight. We like to put them out to pasture. Wintertime, not as much. Sunlight will kill the fungus. And then there are antifungals we can use. Topical and systemic antifungals. So there are creams you can put on top. There are antifungals you can give them. Those antifungals that you can give them, they are kind of hard on the liver. And then you have to also be wary of, giving medications. Are we getting milk from that animal? Is this animal going to be slaughtered anytime soon? Because we want to be careful with the medications that we use when we're doing that. Because it's self-limiting, you can not treat. Some say to deworm and do antibiotics. Remember, it's a fungus, not a worm. So deworming doesn't really do anything except if there is a parasite. If they have parasites, they can take a hit to the immune system, and that could cause them to be more susceptible to it, because parasites suck nutrients from us, make us a little bit sicker. It does cause some immune compromisation. So maybe that's what deworming could be. Antibiotics, it's fungus. Antibiotics aren't going to do anything unless you have a secondary skin infection or a primary infection that's making the animals sick and making them more susceptible to ringworm. Choke. This is not bacterial. It's not viral. It's obstruction of the esophagus by a foreign object. Ears of corn, eating apples, potatoes, objects in the feed, etc. You can see here we have an object in the esophagus. This is the trachea, this ring thing here. The trachea is made up of rings of cartilage. This is the esophagus. It's all smooth muscle. We have something here. I'm not really sure what that is that's in there, but it's some sort of foreign object that is causing the esophagus to be blocked. The esophagus is blocked. Things don't go down the esophagus, and they can't swallow, they can't eat. That would be a surgical repair. That's the only way you're going to do that. Excessive salivation will be part of this because they can't swallow. They're going to feel sick. They're also going to bloat because cows make a lot of gas. They burp constantly. And if they can't burp, if they can't do their, and they also vomit. You guys have heard about chewing their cud. They vomit up and they chew on their cud, and they so that they can keep reabsorbing urea. They can't do those things, so then they start to bloat. They're going to be in extreme distress. It's going to be exhibited by persistent chewing and swallowing, protrusion of the tongue and coughing, grunting, coughing, difficulty breathing, because that can start pushing on the trachea, causing the trachea to collapse and making it harder to breathe through that. Also, that bloat that starts putting pressure on the chest as well, making it harder for the diaphragm to expand. Diagnosis will be through clinical symptoms. You can try passing a stomach tube down the esophagus. When that stomach tube doesn't make it to the stomach, we know there's a problem, and you can actually tell how far down it is by how far your tube is. You measure where your tube stops, you pull it out, and you can kind of then you hold it up to the counter like, all right, it's right about here. Because of all that salivating, that is a symptom of rabies, so you do have to consider rabies. Treatment, first you're going to relieve the bloat. You can either do that by surgery or trocherization. What that means is you're going to take a tube, or in dogs we use a large bore IV catheter, or typically an IV catheter because that's what's deep enough to get in there, and you stick it right through the abdominal wall into the stomach, and it helps. And then you can put some gentle pressure on the stomach and push the extra air out. If there's fluid in there, that'll come out as well. Then you're going to need to remove that object. You can do it, if possible, if it's close enough, by manual manipulation. This is pushing on the throat and trying to get that object to move up and come out of the mouth. or instrumental retrieval. You can take some tongs, and depending on where it is, you can reach down there, grab it, and pull it out. Be very careful with that. You don't do any damage. And last resort is you would do a ruminectomy or cervical esophagotomy. Depending on where it is, if it makes it to the stomach, you are going to have to open up the stomach and pull that object out. If not, you are going to have to cut through the neck and find where it is in the trachea and cut that object out. Surgery is expensive. There's recovery time. Depending on what that cow is used for and how old it is, they may just euthanize because that isn't a very expensive option. Bloat is another one of ours. We talked a little bit about it in feed diseases, or we would have talked about it in feed diseases. We didn't get to those. We will go back to those. This is also known as rumen tympani. It's accumulation of gas in the rumen and reticulum causing distress and frequent death. It's accumulation of gas in the stomach. Same thing happens to doggos, except dogs, their stomach flips as well, and it starts cutting off circulation to the rest of the gut, as well as the stomach. This is going to cause a lot of stress, and they will die quickly from bloat. Same with dogs. What causes it? Obstruction or injury to the esophagus to prevent eructation. You can have mechanical obstruction. And nutritional. If they eat a lot of grain diet or a lot of legumes that are out in, which are like bean type plants in the field, this can cause bloat. It is known as a frothy bloat. I would know that word. I would know that, and what causes frothy bloat, and that high-fed grains and legumes cause frothy bloat. And this causes, because it creates a lot more gas, it will cause them to bloat faster. It also gets frothy, which makes it harder for them to burp and erupt. Symptoms. Keep this in mind as well. This is important information. Distension of the rumen of the left side at the paralumbar fossa. So the paralumbar fossa is, let's see if I can go up and find, paralumbar fossa is this area right in here. But you're going to get left-sided initially. In severe cases and later stage cases, you will get bloating on both sides, but the bloat starts on the left side. That's important information. Could be a test question. So distension of the rumen of the left side. They're going to have respiratory distress. Again, we talked about that, depending on what's causing it. But either way, they're going to have respiratory distress. As that abdomen distends and the stomach distends, it's going to put pressure on the esophagus, prevent that from being able to lower the way that it should. They're also in a lot of pain and discomfort, so this will cause them to have some respiratory distress as well. They're not going to eat. Bloat can occur in as little as 30 minutes. Same thing can happen to dogs. You feed a dog, you leave, you go home, you leave for an hour, you come home and you find a dead dog or a flat out dog. In order to treat this, you're going to have to relieve that intraruminal pressure. If there's no obstruction, you can pass a stomach tube. You pass it through the mouth into the stomach, and it lets all that air come out. Fluid will start coming out often. We talked about trocherization. That's where you're going to stick a in cows. It'll be probably bigger. You're not going to use a syringe because it's a much bigger animal, much bigger stomach, or not syringe, but IV catheter. But something, so you're going to stick something right through the abdominal wall into the stomach to relieve pressure and get some of that air out, get some of that fluid out if it's frothy. And finally, a rumenotomy. You're going to do surgery. You are going to cut into the animal, and you are going to relieve that pressure, clean it out. In dogs, it's always, you start with a stomach tube or trocherization because you want to relieve that pressure, and then it's always surgical. If they have gone into GDV, which is gastrodilation volvus. This is where the stomach actually flips upside down and starts cutting off circulation. The only way to fix that is you have to go in and do surgery and put the stomach right, or you euthanize that dog, because otherwise it is a very horrid and painful death. But you have to relieve that pressure first, either through a stomach tube or trocherization, before you can go in and do surgery. You can also administer defoaming agents, so poloxane, vegetable oils. All surfactants make herbicides stick to leaves. So if they're out there eating a lot of leaves with herbicides on them, that can cause some frothy bloat as well. By the time the condition is recognized and help can arrive, the animal may be close to death and treatment may be heroic. Means the chances are they're not going to survive, or you're going to put a lot of money in to survive. You may get them back and you may get them around. Prognosis is usually pretty poor in these guys. Gradually feeding increased amounts of roughage before turning cattle out on pasture or giving them grain. So you don't want to just suddenly switch diets. Same thing in dogs, you don't do that. Because this will cause them to bloat, because it causes some stomach upset. Their gut needs to get used to that diet change. Feeding defoaming agents will also prevent bloat. That's what prophylaxis means, preventing the disease. Grain overload occurs when beef cattle are brought into feedlots. Feedlot is a term for that last stage of beef cattle. This is when beef cattle, they put them out to field, or they start feeding them grain in order to fatten them up for slaughter. I think it's like 4 to 6 months at the end of their life to fatten them up, getting them ready for slaughter. That's what feedlot means. And or when cattle accidentally ingest large amounts of high energy grain feed. This is when we get grain overload. Rapid fermentation of those carbohydrates leads to lactic acid production, and they get lactic acidosis. Symptoms: anorexia, they're not going to eat. Decreased ruminant activity leading to atony. Atony means it's going to stop. It's not going to work anymore. They're going to get very depressed. They're going to get very lethargic. They're going to have soft to very liquidy, very, very stinky stools, because lactic acid pulls in H2O, which is in the gut. So they start absorbing more water into their gut and into the feces matter instead of retaining it like they're supposed to. Metabolic acidosis or death will also be a symptom. Treatment: you got to empty that rumen. You can do it via stomach tube, passing a tube down the throat into the stomach, flushing it out. A lot of times you're going to kind of pump your stomach. You're going to fill it with water or saline, and then you're going to dump it out, suck it out. Or you do the rumenotomy. You're going to cut into the stomach and you're going to empty it out. Okay. Very expensive procedure to do. You need to do fluid therapy. You got to correct that acidosis. And you got to correct the dehydration. All that diarrhea, pulling all that water out, they're going to get dehydrated very quickly. You need to correct that. Mortality is very, very high in grain overload. So we need to be careful. You need to prevent it. You need to do gradual diet changes, because this is an expensive fix for one thing, and they get very, very sick very, very quickly. So slaughter should be considered for these grain overload patients. Traumatic reticuloperitonitis. This is also known as hardware disease. Anatomy: this disease is seen only in ruminants due to their anatomy. The reticulum is next to the heart. Reticulum is part of their stomach. So what happens is they go out, they're grazing, they're eating stuff out in the field, they swallow some screws, they swallow some nails, some wires, something along that lines. This sharp metal object gets into the stomach, into the rumen part of the stomach, and there it penetrates the reticulum, through the diaphragm, and then the heart. It causes infection and pericarditis, infection around the heart. what happens with this is, what causes this is their eating habits. They're not selective eaters. They will eat strange objects. They go out and eat whatever the heck they can get in their mouth. You can see here, this is a wire through the stomach. These are the folds of the stomach, the rumen. It's poked through into the heart, lungs. You can see the rumen right here. Whoops, go back. You can see this is the stomach. This is the part of the stomach that's called the rumen. Here's the diaphragm. There's the heart. You can see how easily it can just... The way we fix this is we feed them magnets. We shove a magnet down their throat. Well, they'll eat anything anyways, right? We shove a magnet down their throat. We put a magnet and it sits in their stomach. And all of that, whatever they swallow, all those medical objects that can puncture the rumen and the heart, stick to that magnet. And you just give them, it's a lifetime fix. You drop a magnet down their throat, you don't worry about it. Symptoms of heart disease, anorexia. They're not going to eat. They don't feel good. They're going to get a temperature because they have an infection around their heart. Respiration rates, they're going to increase. Heart rate, going to increase some. Lot. Behavior changes. They're going to have a stilted gait. They're going to start walking funny. They're going to get depressed. They're going to be reluctant to move because they hurt. They're going to arch their back because they're in pain. That's a sign of pain in animals all the time. Our four-legged animals, they arch those back because they're guarding their stomach and they're guarding their abdomen. There's going to be a sudden drop in milk production. They don't feel well. Stress causes milk production to decrease. Death. Sometimes death is the first symptom you see. Diagnosis, you're going to look at the history, sudden onset and clinical signs of pain and depression. You're going to look at clinical symptoms, pain, depression, elevated white blood cell count with a left shift. Because we have an infection, our white blood cell count is going to skyrocket. Respiratory distress. We've punctured that diaphragm. It's going to hurt them to breathe. They're going to have a xiphoid reflex or a Withers reflex. This is pinching them, and they're not going to want to move. You can use a metal detector and detect the metal and where it's at. To treat hardware disease, you're going to have to do surgery. You're going to give them antibiotics because they have an infection. Prognosis depends on the severity of the condition. It's generally pretty poor, and it's an expensive treatment. We're probably going to call those animals. Magnets are very cheap. They're very effective. It lasts a lifetime. It keeps pieces of metal and nail stuck to that and keeps the rumen and the chest free of those. Left LDA is left displacement of abomasum. So this is our stomach here. The abomasum is this part of the stomach down here. It flips, it moves, kind of like GDV in a dog, except it's just the abomasum part that moves. The abomasum should be low and to the right on the left side of the stomach. Cows that are fed a heavy grain diet or concentrated rations are the ones most likely to develop this. Parturition, which is giving birth, seems to be the most common precipitating factor. Giving birth tends to happen prior to this. It loosens everything up in there, makes a lot of extra room. Mounting during estrus, so breeding, can affect this. It's most often a secondary issue to those other things. So this is where our abomasum should be, right here. Or your omasum, your reticulum, your rumen. This is where your abomasum should be. What happens is this abomasum that should be down here ends up over here. If you notice, everything's kind of adjusted. Your abomasum should be down here. It ends up over here. It can also end up on the right side. We call that right displacement of abomasum. Pathogenesis, probably that during pregnancy, the rumen is lifted from the abdominal floor by the enlarged uterus, and the abomasum is pushed forward and to the left under the rumen. Symptoms, sudden decrease in food consumption. They're not going to want to eat. Appetite may return, but it's intermittent and selective, so they're only going to eat a little bit of this or a little bit of that, their favorite foods, and it can come and go. There's going to be decreased in rumen sounds because you're not going to, because it's not where it's supposed to be. You're not going to hear it as well, and it's not working as well. Decrease in milk production because, again, stress, pain, milk production decreases. Ketosis. This is when our glucose gets, our glucose is often too high, or it can happen with stress, and we get ketones that is a byproduct of digestion, will end up in high quantities and cause us to be very sick. You often hear it with diabetics, diabetic ketoacidosis. This can be life-threatening very quickly. Swelling in the paralumbar fossa. Remember, we talked about that fossa with bloat. You're going to get some swelling there. You will also hear a ping heard upon auscultation. This is why they call bloat tympany as well, because when you thump or flick the side of the abdomen, it's going to sound like you're beating on a drum because it's kind of hollow there. Dogs do the same thing. When dogs bloat, if you flick their abdomen or thump the abdomen, it sounds like you're pounding on a drum because it creates this tympanic type sound. Auscultation with a stethoscope on the left side, so you're going to listen to the left side behind the ribs where the stomach should be. You're going to hear a tinkling sound of gas bubbles, a pinging sound, like a basketball, when you thump it, like a basketball dribbling or the dropping of a stone into a well. Treatment, you can roll them around. Surgery, you would do left displacement abdominal surgery, kind of like bloat surgery in dogs. You can do blind suturing where you're kind of going in there blind and trying to suture it back into place. There are some other treatments, but those are the most common. Again, expensive surgeries. Sometimes if you roll them around, you can get it back in place. Right displacement abdomen, this is very similar to bloat in dogs. This is it's an actual torsion. It's going to cut off circulation because when it torses, it twists. It twists the vessels, it kinks them. They can't get blood to the stomach anymore. This requires surgery to correct, just like in dogs. Agrocirrhosis. This is starvation. That's a fancy word for just starving to death. What causes it? Diet. It is deficient in everything but crude fiber. They're just getting a fibrous diet. There's no vitamins, there's no minerals, there's nothing else that they need. This happens by feeding poor quality hay and or corn stalks. Sometimes you're going to get late gestation in 50% of cases will cause this, or in late gestation because the baby's taking everything. Inclement weather can cause this because we're not getting good grain and good, the outside, there's drought, there's not, or there's a lot of snow, they can't get to grazing. This is usually seen in late winter and early spring when there's not good quality grass and hay out there. That's what a cow looks like when starving. You can see the spine, you can see the hips, you can see the ribs. We're not supposed to see them like that. Symptoms: emaciation, anemia, edema, which is the swelling around the jaw, causes bottle jaw. Again, you're going to get ketosis. We're going to get ketones in the blood. They're going to get bloated. This often happens with people when they're starving. They start to bloat. They keep eating, but they go down. They're eventually going to be a down cow because they're weak. They can't do anything. Diagnosis: you're going to look at clinical symptoms and history. You're going to differentiate underlying symptoms that could be causing cachexia. Cachexia is that muscle wasting, that bony appearance. Cachexia is not a good word when it comes to what it means. It is one of my favorite words to say. Oftentimes when you see a dog that looks cachexic or has cachexia, they're going to have hollows in their skull. You can be able to, like right above their eyes, it's going to sink in there. That's often a sign of cancer in dogs. It also could be starvation. Treatment: you're going to give glucose. You need to get their sugar back up. You need to give electrolytes. You need to start replacing what they don't have. You need to give them shelter and heat because they have no fat. They have nothing to keep them warm. They have nothing to protect them from the environment. They're going to need some tender loving care to bring them back. Antibiotics. in case there is an infection, or so they don't get secondary infection. And if the pregnancy is if the fetus is taking all of the nutrients and the cow is starving to death, you can abort those babies to save the cow's life. Prognosis, it's poor. Once the animal's gone down, getting them back is not likely. Metabolic nutritional disorders in dairy cattle, these are pathological conditions that occur because of the presence or absence of certain chemical factors. In these conditions, there are not any infections. They are just poor diet. Metabolic disorders, often but not always, are the result of nutritional imbalances, usually the absence or deficiency of a nutritional component. These are kind of say the same thing. Pathological conditions, so there can be some conditions that are not just nutritional. These occur because of the presence or absence of certain chemical factors. In these conditions, there are not any infections. Metabolic disorders are often but not always the result. I'm sorry, did I? I really thought I thought I hit the button and it's changed. I was like, why is it saying the same thing? Occurrence. This is seen in high-producing fresh dairy cattle, hypocalcemia milk fever, or also known as parturient paresis. We can see this in dogs as well. This is a cow has just given birth. They're making high quantities of milk. They don't have enough calcium to support themselves. You require calcium for your muscles to move. You require calcium for your heart to pump. Muscles need calcium to do their thing. It is part of the chemical process that creates muscle movement. And without it, you'll become paralyzed, stiff. Your heart rate will drop. It's often within 72 hours, but can be at birth or months later, depending on the diet. But usually most often within that first 72 hours. We up their calcium intake when they're just before birth so that they have enough, and you keep it up after they've given birth because of all that milk that the baby takes. It takes a lot from mom. Milk production reduces bone and calcium levels. Clinical signs in the early size, they're going to start twitching and seizing a little bit, like having little muscle twitches because the muscles aren't working properly because of the lack of calcium. Ear twitching, head bobbing. They're going to become excitable, hypersensitive. They're going to get ataxic. They're going to look like they're drunk when they're walking. And they're going to cry. They're going to become very, very vocal. Advanced signs and symptoms, anorexia. Subnormal temperatures, the temperature is going to drop. You're going to end up with a down cow. They're going to turn their head to one side. Atonic anal sphincter. The sphincter is no longer going to be able to do its thing. It's going to not move anymore. Lack of Borborygmus, and I looked that word up and I don't remember what it means, so give me a second here. Oh, gut sounds. That's what that was. I remember that now. It's gut sounds. So what all of us, animals included, when you put your stethoscope on the gut, you should hear digestion happening. There should be gut sounds. You should hear gas moving. Some of us, you don't even need a stethoscope to hear that. I'm looking at myself there. So you're not going to hear gut sounds because, again, smooth muscles require calcium to move, and there's no digestion happening. It's not doing anything. Tachycardia, the heart's going to beat very, very fast. Death if untreated. Here we have some down cows with hypocalcemia, low calcium, milk fever. So low blood calcium is what causes this due to low diet levels and high amounts lost in lactation. Diagnosis is through history, clinical symptoms. You're going to take some blood work. You're going to run it. You're going to see that there's lack of calcium. They're also going to have low magnesium and ketones. Treatment, you are going to give IV calcium gluconate. We need to replace that calcium. But you must do it carefully, and you have to monitor that heart rate while you're doing it, because calcium can cause fatal cardiac arrhythmias. Same thing in dogs. When we have to give calcium to dogs, you typically have them on an ECG machine, and you are watching them very carefully as it's going. You need to give this very slowly and monitor constantly. May relapse and need additional treatment. Increase the calcium in their food and keep close eye on them. You may have to do it again. You can also and will give oral or IV glucose if they are ketonic as well. Prevention, feeding good quality rations. Some people give vitamin D because vitamin D does help calcium absorb. But you have to feed good quality food. Don't go cheap on the food there. Old treatments center around feeding low calcium phosphorus diet prior to calving to promote an increase in bone absorption. So, I don't know if you remember, but in